Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality. So, hey, everybody, I wish that you had just been here for the last 20 minutes when Dr. Anna Toker and I were talking about everything surgery. Listen, it is not that often that I get to talk to another female surgeon who's about my age, who's had the same educational pathways going from research and academia into private practice, and what that means, and how much we hate insurance companies, and that we can solve your problem. We just can't solve it by tomorrow. So we have had this great conversation, and I want to let you in on it. Dr. Anna Toker is a colorectal surgeon who did start out as a researcher, has this magnificent academic pedigree, and has evolved her practice and the way she influences people into a private practice as well as a public practice, meaning that she too is all over social media. She hosts a live stream meant to educate you called The Surgical Bullpen. She is deep into the microbiome and has a product called Xyve7, which we will talk about all the things. So, Dr. Toker, I'm so glad that you joined Hot for Your Health today with all my fascinating, smart, savvy people.
Yes, thank you for inviting me. That's awesome. I'm excited to be here.
I'm glad you're here. I have not had a colorectal surgeon on before. You are awesome. I just told you, don't tell anybody else, that you guys are like the real surgeons with your hands in the guts and everything. But tell people who don't know the scope of practice for a colorectal surgeon, right? Where do you end? What do you start there?
So to be a colorectal surgeon, you have to be a general surgeon first. It is a double board. So much like you did a residency and a fellowship. Colorectal surgery is not considered a fellowship. It's considered a second surgical residency. So there's two oral board exams. Okay. Do you hear what I am saying?
So sorry. And that means you were in school frigging long time.
Forever. Oh, wait, let me turn that up. Yes, horrible. Okay, so there's a lot of training that goes into colorectal surgery. Why do we choose it? Like if I had $1 for every time someone asked me, this was not my aspiration, people. No, like I would have chosen, we were just talking about how I would have chosen to be a sports medicine orthopedic surgeon, to be frank.
Yes.
But, I enjoy saving people's lives. I'm a person of action. I think most surgeons are. The concept of just giving someone a pill every month for the rest of their lives was just never really my thing ever. And so I enjoyed general surgery. I got married my intern year as a resident. Life back then, as you remember, this was almost 30 years ago.
There was no work hour restrictions.
No, there was no.
What does that even mean?
Oh my God. Not only was there no work hour restrictions, the women in the program, and there were 2 of us, had what they call direct observed therapy, like we do for TB, except it was your birth control pill. The director of the department watched you take a birth control pill to prove that you weren't going to get pregnant during your residency program. And so anyway, so I get married during this period of time, and here's a interesting concept. If you take an antibiotic, guess what doesn't work quite as well?
That's right.
Your birth control pill. So I got pregnant my chief year. I was a chief resident, and I got pregnant, but I couldn't tell anybody because I was pretty sure I would lose my job as a result. And it was very, very early in the pregnancy. The baby was due mid-June or so, mid to late June. And in the middle of the night, yet another night where I'm on call, trauma, person's riddled with bullets, right? And the anesthesiologist who's in the room is probably in his mid to late 60s, and the attending on the other side of the table is probably in his mid to late 60s, and then there's me, and they don't know that I'm pregnant, but I know that I'm pregnant, and I'm thinking, oh my God. And meanwhile, my husband, who was in the Army, had left the Army to start medical school. He wanted to be an anesthesiologist. He was a freshman in medical school. And I thought, oh my God, now I'm having an out-of-body crisis, because if I am in the operating room and Steven, my husband, is in the operating room, who the hell is taking care of the baby once it's out of my body? Like, it never occurred to me. Okay. Like, I'm 35 years old, and it never occurred to me that once the baby is out of your body, that's actually where the problem is.
Yeah.
It's not the act of being pregnant.
Right.
So at that point, I had to start looking around for, and thank God I studied hard through school and through residency. So I had great in-service exam scores and all that kind of stuff. I could pretty much choose whatever I wanted to. I was being recruited by plastic surgery, the plastic surgery department. But the thought of looking at chicks and like giving them bigger boobs, like I would want smaller boobs personally. Makes you more aerodynamic, clothes.
Better narrow, better. I mean,
Yeah, I mean, you get to better forehand, better backhand, like your clothes fit a little bit better. Like, I don't think I would be a good judge
surgery. Yeah.
of juggernauts. I can't, I mean, like, I'm a good at a closure. I can do a facial reconstruction pretty nicely. But anyway, those people are facial reconstruction. That's in the middle of the night, beer and beating for a buck, right? That's somebody who's been in a barroom brawl. Everything is broken and you reconstruct it. Now that's fun to do at 1 a.m. when you're a resident and the attending is sleeping in the back corner and you get to operate by yourself. But when you're the attending and you don't get to sleep in the back of the corner because you're the one taking care of it, not so much fun. And so I started asking around. Really, the only guy I never saw after 5 p.m. was the colorectal surgeon.
Oh, there was nobody doing guts in the middle of the night?
The general surgeons do that. So that's a loophole, right? So now when we worked with him, it was only in the operating room. I never stepped into clinic with him, so I did not know what clinic was like at all. And I had completely forgotten, we relegate interns to help to helping him on, not to clinic. No one ever went into clinic. The interns helped him do butt cases.
Oh, so you did not know what you were getting.
So it had been 5 years. I couldn't remember. So, right. So interns are in charge of feet and ass, frankly. So if you're chopping off feet or if you're fixing someone's butt, you sent an intern.
Yeah, it's actually true. Okay, anybody listening, I want you to remember, we would never lie to you. And we are two women surgeons who have been through it, people. This is true shit.
True shit.
This is the way it is.
No, it's totally the way it is. Okay, so it had been 5 years since I had done like the intern routine with this guy. So I didn't remember that. What I know is that really cool reconstructive surgery, somebody with cancer, diverticulitis, like really complex stuff. The general surgeon, yeah, like I mean high tech stuff. The general surgeons wouldn't dare touch that stuff. You are a specialist, right? And I thought, that's cool. That guy he was a great surgeon. He's never in the hospital. Okay, maybe that's what I should do. And in the school, my husband at the time was in Houston. I was finishing up my residency in Dallas. And Houston has at the Methodist Hospital there has a great colorectal department. So I interview, I get accepted to the colorectal department. Now this is where it gets fun. I have my baby. She comes early. I had
who's taking care of this baby now?
Dude, okay. Oh my God. So when I was pregnant, when you're working 100 hours a week and on your feet all the time, like do that while pregnant. Why don't you?
I know. And how'd you shimmy up to the table when you're
well, I used it as a little
table. I used her as a table.
Oh, yeah. Yeah. It gets a little harder when you lean forward and they start kicking because you're like, you need to hold still so I can do what it is that I want to do. But so it's not the easiest, and my blood pressure was super high, and I had oligohydramnios, so there was very little fluid around the baby. It's just because I was under stress. Yeah. So they were giving me a liter of saline every single day IV. I came to the hospital an hour before rounds to get my IV infusion. They would do an ultrasound just to make sure all the little pockets of fluid or around the baby. And then I would go with my 14-hour day, or if I was on call all night long, By the end of the pregnancy, when I was sort of in active labor, literally in the emergency room in the ICU, they had one of those patient family recliners. You've seen those?
Yeah.
I was so swollen. I was so Jabba the Hutt. It was so horrible. It put my feet. So, I was a small person. No, not so much when I had this child. My feet were so swollen. I was pouring out of my shoes. Anyway, it was horrible. And she came early, and fortunately for me, I'd already met all the I'd done all the cases, and so I'd met all my requirements. I was at bed rest the last 2 weeks. Patients rounded on me. It was fun. I had my intern throw the patients in wheelchairs, and they would wheel them up to the labor delivery department to see me. I'd sign off on notes and, had to finish a couple of papers and all that kind of stuff. So to finish my program.
Yes.
And so I have the baby. Everything's cool. I moved to Houston, and my first day, July 1st, the routine, July 1st start. And the first day was clinic. Like, I didn't remember this aspect of clinic, but do you have any idea how many buttholes I had to bugger on my first day of clinic? It was horrible. Okay. Because I didn't like
an orthopedic surgeon. I'm a skeletal muscle doctor, not a smooth muscle doctor. So I have no idea what you're talking about.
well, I'm doing rectal exams on everybody for who's in right. That's it. Just to give statistical numbers so people understand, to get a person to the operating room for a hemorrhoidectomy, you've got to see probably 10 or 15 people who don't need surgery.
That's right.
It's kind of miserable. You give them some medical management, they don't need an operation. Well, we never ever sent somebody to clinic. We only went to the operating room. So, and this surgeon had, and like I do now, 7 to 10 patients per week on a given day for surgery. Well, that represents 80 buttholes that you had to booger around in to find those 7 patients.
Surgeries, yes, that's right.
Right. Okay. I was not prepared for that. I don't remember having to do that. So
it was like a secret you should have known. You should have known.
Early.
Told
Yeah,
you.
what did you? It's in the name, Anna. Rectal. So, okay. So I come home. I told my husband, I was like, this is the worst day of my entire life. he's like, I hold the baby. It'll make you feel better. So I'm holding the baby.
Mm-hmm.
And he goes, all right, okay. He goes, give me the baby back. I was like, okay, you can have the baby back. He goes, now go down to the hospital and sign up for trauma call, for God's sakes. You're a board certified surgeon. You can earn a living if you want to. You do not have to continue to do this.
Trauma doctor.
And yeah, and he knew I didn't want to do that because I didn't want to be a trauma doctor like I was in residency, because that was very.
That is a bad life.
It's a bad life. It is. And so, all right, fine. I go the next day to work, and we were in the operating room doing, really, again, some of the coolest stuff you can imagine. Methodist Hospital in Houston was one of the first hospitals in America to have a robot. So we got to do some of that stuff. I mean, people from all over the world came to have their surgeries there, and famous surgeons had their practices there. So it was a great place to train. I kind of had to get over the physical exam situation. Now it's sort of like I make fun of it. And at the time I had a baby. So it's sort of like I could use, I'm changing diapers. I'm looking at people's butts as well. It's like it just got to be kind of like,
right. That's right. That's just the end of people you see. Yeah.
Yeah. Yeah. Just drop them. I mean, you're going to moon me. What the hell?
Whatever.
You can't shock me now.
That's right. I mean, there really is nothing. Nothing.
What these eyes have seen. You don't want to know.
What's your favorite surgery?
Well, kind of like, this is going to sound macabre to people who are not surgeons. There's almost no surgery that I don't like, to be frank with you. If I can interact in a physical way to fix what hurts someone, and that's my favorite surgery. I'm egomaniacal because I'm a surgeon. I think you understand where I'm going with that. So if I can do an operation that no one else in town wants to do or can do, that's really my favorite surgery. So I do like, especially because it's such a boys' club, not
Mhm.
as much as what you are living through. But in colorectal surgery, it's maybe 10 or 15% of the doctors are female. Um, and so when all the boys in town refuse a patient, and then I do the surgery and the patient does awesome, they go home in 2 days and whatnot. To me, that's my favorite surgery. There's really not the technical ones. My least favorite thing to deal with, honestly, are these very low-lying rectal cancers
Oh,
because it is so hard and disfiguring on the patient.
oh.
Like, not only am I doing a hard surgery, but I'm breaking bad news to them, and the
Mm.
recurrence rate's kind of high. And then, of course, they got to have radiation. Sometimes they're left with a colostomy forever. And, so,
Oh,
so that to me is an emotional toll because it's hard for me to tell people bad news. And I do it all the time.
right.
I got to
Well,
leave problems all the time.
you have pivoted part of your life into wellness. So if we don't want to have to give quite as much bad news, which is my approach to osteoporosis and fracture, and I'm a sports doctor, and I want to maintain joint longevity. If we want to pivot from only being able to tell people bad news, how can people avoid, in a lifestyle way, colorectal surgery?
Yes.
How can we make it healthiest down there?
Yeah, so in fact that is kind of my calling card. And I had patients from the time that I started my practice because I know how hard it is to recover from some of my surgeries. Like the hemorrhoid surgeries are tough. And I wouldn't want that surgery if I didn't need it. And so I was always told as a surgeon that you did the right surgery at the right time on the right patient for the right indication. And just because you walked into my office and said you think you need surgery, well, it doesn't mean you need surgery.
That's right. I
Mm,
choose. Right.
yeah, I get to choose. And so I think when you have a willing partner, oh, they don't want to have surgery, then I've always had patients do lifestyle modifications that used to be the standard of care in all of our specialties, if you remember. Make
Mhm.
them eat better, have them drink more water. There's certain behaviors you don't want to do for certain types of conditions. And that started to morph into as and you've noticed this also, no doubt, the patient population now compared to when we were in medical school, like how much more sick are they? It's crazy, right? I mean,
People have diabetes and don't exercise. Very sick.
oh my gosh, and it's when I was in college, because I wanted to stay an extra year for my tennis eligibility, I picked up a chemistry degree. So I majored in biology and I majored in chemistry. And at the time there weren't,
Basket weaving. It had to be chemistry. I mean,
oh my God. Hey, sir.
stay.
I'm a little bit of a nerd and I'm a natural at science. So to me, I would have failed basket weaving. But at the time, not a whole lot of people were volunteering to take physical chemistry to get a chemistry degree. You know what I mean? Like that was the one thing that stopped people. And I dared to do things other people's can't. This is why I'm a surgeon.
Yeah.
And when I finished college, and I knew I wanted to go to medical school, and I headed off for an MD PhD program, but I was offered a very lucrative job from McCormick Spices. And I thought, that's so strange. Why would a McCormick Spice want a chemist? And I turned the job down. I could have used the money for a couple of years and then gone to medical school. But I thought, chemists, that would be the most boring job. There would be no role for me in that. And probably 3 or 4 years into my private practices, I'm seeing people gain more weight. And it's always complaining about belly complaints and cramping. It's like getting worse. And even people who should be healthy are like miserable from a gut standpoint. I'm like, holy shit. McCormick probably does have chemists working for them. It's in the food. So then I started kind of going down this look. 85% of people with IBS actually have gluten sensitivity. And it's not, a lot of that sensitivity is brought on by the way we raise the gluten, the wheat, the way we raise it, the way we spray it, the way they dry it, the way
Mm-hmm.
they process it. makes it all inflammatory. They keep all the inflammation and they get rid of all the nutrition.
All the nutrients.
Yeah. So if you've got IBS, that the first bit of advice I started giving people is you're not celiac disease. Your test will be negative if you test for celiac disease, but there's an 85% chance if you went gluten-free, your stomach complaints would stop. And that's a true statement. And so it just kind of morphed from there. Like, what else could people kind of do or not do? Like, if you've got diverticulitis, even with an abscess that had to be drained,
Which is a little pouch on your intestine where things get stuck in there for those that are listening, right?
it's like a hernia. Yeah, it's the aging process of the colon. It's very common. Half of the population has this as they age. They can get infected, like your appendix can get infected. And when I was in my surgery residency, that was an operation.
Yeah.
If you came in with diverticulitis, especially if you were under 60, even if it wasn't complicated, we did surgery on that person just like we would an appendectomy.
Yeah.
And that was the mantra forever and ever and ever. And someone finally asked the question, really? I'm like, you really have to be doing that? And you don't. If someone walks 30 minutes per day, even if they've had an episode of diverticulitis, they're much less likely to ever need an operation. There's just something about the physical action of walking that improves things. You know, during COVID, when no one could get out and walk, the incidence of diverticulitis in my practice probably tripled or quadrupled because people were sedentary. They're sedentary. They're, eating terrible foods. Uber Eats is coming in. They're not going to do anything. That's a diverticulitis setup. So
Is that because the gut doesn't move when you're sedentary? Like there's less passage, less peristalsis, plus nobody eats enough fiber.
right. It's a combination. Yeah. So like people who are paralyzed,
Yeah.
they all struggle with gut motility issues. Because your body needs the core to kind of do this little, twisting action. That helps stimulate the intestines to move around. It also sends all the right nerve signals. So yeah, activity has a lot to do with your gut health. How fast you eat. You eat too fast, you're going to have horrible gut health. If you don't chew your food well enough, you're going to have horrible gut health. If you eat a lot of processed food because of the seed oils, you'll have horrible gut health. If you eat gluten, you'll have horrible gut health. So there's really simple things that someone can do to avoid someone like me.
Tell everybody how not to have to come see you through these simple things. You've just list them off, and how not to be bloated all the freaking time. Because that's right here from the people who listen to me.
Yes.
But their genes no longer fit. Their belly is, and I understand this. I started eating yogurt for the first time in my life because I find that helps me not be bloated. I mean, so give us the 5 things if there are 5.
No, there's probably more than that, but yeah. Okay, so the very first thing to do is avoid gluten, right? We already covered that. The second thing that I would tell people to do, especially if they have like heartburn, how many of your patients are on an antacid right now, right? Omeprazole or something. Omeprazole will worsen your belly bloat.
What?
Yeah, because your stomach makes acid, and that acid is required for digestion.
Yeah.
And that acid is also required to control the bacterial population where it can travel. So if you don't have acid coming from your stomach, then the bacteria that are supposed to be concentrated towards the end of the small bowel and the colon, well, they start migrating. They want to get faster to the fun, right? They want to get closer to the food before you can get to it. So you'll know that you have a bacterial issue, a microbiome bacterial issue, if you eat something and within 30 or 40 minutes, you get belly bloat. That belly bloat issue is almost always because bacteria got to the food before you did, fermented that food into methane gas, which is a painful distension, which also slows down the intestines so they don't work properly. And then that will worsen your reflux. And then you'll tell yourself, see, I need the protonics or whatever.
Yeah.
So it becomes a self-fulfilling prophecy at that point. So if you're on an antacid, those were not designed to be on forever, except in very rare occasions. So consider weaning yourself off of that, and that will actually improve your gut health.
Oh,
Just
interesting.
chewing your food better, small
How do
bite.
I choose? Because I'm a surgeon and I eat standing up in
No,
a kitchen.
me too. I know it's
Later.
right. Yes, I eat and walk. I eat, walk. I eat, walk, check emails, and call the office all at the same time.
Yeah.
It's how much internet, right? You know what? You want to make sure that if you take a really small bite and you kind of chew it, take your time because you're not in a hurry. You're just walking and eating, until it's a paste. You don't want to have like chunks of food go down the hatch. Now, this issue of being in a hurry is why people will reach for processed food as a priority because they know it's easy to eat.
Mm-mm.
It's quick and easy to eat, and I have a case in 5 minutes. Like, like how am I going to eat a salad in 5 minutes? Not easy.
Hard. Yeah.
So it's easier to reach for a protein bar, which sounds on the surface like it's good for you, but it not. So you want to eat real food. I suggest people eat multiple small meals throughout the day so you're not starving, so you don't have to wolf something down.
Yeah.
Right? So multiple small meals throughout the day helps.
Grazing all day long.
Grazing all day long and chewing very well, it will help improve gut health. Another thing that you could do, we talked about walking,
How
is
much fiber and what kind of fiber does a colorectal surgeon suggest? Because I suggest, bone doctor, orthopedic surgeon, 30 grams of protein a day.
or fiber, you mean?
Yeah. Oh, yeah. Protein, I suggest a lot more.
Yeah, for sure.
30 grams of fiber.
Yes.
A day.
So that was the standard forever and ever and ever, 30 grams. And the big question is of what variety?
Yes, tell us.
So there are two types of fiber. There's soluble fiber and then there's non-soluble fiber.
Mhm.
In my opinion, people who have gut issues should focus more on the soluble fiber. Personally, that will help you in a couple ways. Number one, that tends to soften the stool. So you don't have little rabbit pellets going through there.
What is soluble fiber versus non?
Fruit fibers typically.
Oh, fruit. Yeah.
Yeah, so like the number one fruit to eat is kiwi fruit, actually.
What?
Yeah, it's a better than Metamucil. It's better than Citrusil. So if you're going to, for your patients, and I will tell you why this is, a kiwi fruit has three things in it that are critical for digestive health. The first is soluble fiber. So it's got a lot of soluble fiber. The second is it's extraordinarily high in vitamin C.
Mm.
And vitamin C in high doses is actually almost a laxative. So if you have a patient with constipation, high doses of vitamin C are very helpful. Kiwi has that. And the third thing that kiwi has is a very particular digestive enzyme that helps digest food. And so there have been a series of studies where people took 2 kiwi fruit every morning. You don't have to eat the skin, just the flesh out of the center. And that was more effective for constipation than any other constipation remedy over the counter, basically.
Oh.
They're not always in season, so that can be an issue. I mean, you could potentially in season chop up and freeze a bunch and just make smoothies out of it, you know. The easiest way to eat a kiwi, in my opinion, is to take a kiwi, cut it in half, and just spoon out the contents.
Yeah. Easy.
And yeah, and then you just throw that away or give it to the chickens or whatever it is that you want to do with it. But it doesn't have to be scraping the peeling off, and you don't have to eat the Velcro that's on the outside. You know, some people like that. It doesn't matter if it's green kiwi or yellow kiwi. The study has been done on both types, and they're both very effective.
You know what? I love that. You don't hear much in the Menoverse about kiwis, but I'm going to start
No.
talking about it because
Yeah, it's seriously kiwi. That's if someone has like my belly hurts,
give them a kiwi.
kiwi fruit's on there, gluten-free, walk, drink your water, smaller bites, chew better. And then I'll sometimes have people, because we're all both zinc and magnesium deficient. So I tell people, look at night when you go to bed. 50 milligrams of zinc can offset cortisol stress from the adrenal glands, from your life as a surgeon.
Yes.
Women who are menopausal, that's your wheelhouse, right? So women who are menopausal, one of the reasons they will hold on to belly weight is stress response and cortisol
Cortisol and spike.
And so 50 milligrams of zinc every night can help you. It's also good for your immune system, so there's no really reason not to. So just take a zinc supplement. Zinc is supposed to be in your food that you eat, so is magnesium. But we are so irresponsible with how we grow our food. It's rapid growth, and a plant cannot absorb heavy minerals like that in rapid growth. And fertilizer just makes a tomato look like a tomato, but it has maybe 1/3 the nutrients that an old-fashioned tomato used to. So
They don't even taste the same.
they don't. They taste like water. It's like a red skin-colored water thing that's not a tomato. That is not a tomato. So so we all know the food is bad, is not good for us, and the minerals are a reason. Magnesium is another one we're all deficient in.
I take it every day.
Yeah. Yeah. And then people get confused on the magnesium thing, like which one to take. If you have sort of loose stool, which some women who are postmenopausal will develop something called microscopic colitis, which is a diarrhea that's unrelenting.
Oh,
And that's hormone related, by the way. I've never, ever diagnosed that disease in a man or in a woman who's not menopausal.
wow.
So I know it's related to estrogen. There's not a lot of studies on it, but for my patients, I do ask them to try to do hormone supplements for estrogen to offset that.
Yeah.
But anyways, if you've got that kind of stool or it's loose, thought of magnesium might scare you a little bit because it can cause diarrhea.
Yeah. Take the kind we give in the hospital, which is citrate.
Yes. Yeah. Citrate is for my constipated patients.
That's right.
You can do glycinate. You can do topical magnesium.
Oh,
Yeah, that'll get into your system pretty well. And then you can do the glycinate or bisglycinate. Works pretty well. For the constipated patients, it's the citrate and the sulfates. That's what seems to help.
yeah, of course. When I was a nurse, it was those green bottles were our friends.
Yes. There's what I call the not the brown cow. Yeah, it's a brown cow. Yeah, that's it. I call it brown cow.
The brown.
A brown cow is 4 ounces of prune juice and 30 cc's of milk and magnesia.
Oh, yes. Yes. We made those in the hospital.
Yes, you did. Yeah, it's the brown cow. Yeah, of course you did.
Yeah. So bad.
That'll work.
Think about it. Everybody listening, don't think about it, but it works. It's effective. It's totally effective.
When you are in a bind, that is just
Literally in a bind. Yeah. Literally
in a bind. Yes.
And do you still do surgical bullpen? Do you still do that?
Well, I took a little bit of a break. I had to have surgery myself. So I had hyperparathyroidism and had to have parathyroidectomy.
The microscopic 3-cell parathyroid that they have to dig out of, that's hard surgery.
It's fun surgery as the surgeon. I was actually sad that I wasn't going to get to assist in some fashion, but I was very glad I was asleep. But yes. And, found completely by accident. I went to do labs. My med spa, I own a med spa. We talk a lot of wellness. I have a nurse practitioner. She wanted to do hormone replacement. And I thought, okay, I'm not particularly interested, but sure. But that means I have to do the training. So, and then they're like, oh, hey, Toker, you're old. Why don't you do the labs? And then we could learn about what old lady labs look like. And I thought, okay, not offended at all, but I'll happily do that. And my calcium was like 11.5.
Oh.
Now, I had been struggling with horrible, horrible bone pain, which everyone kept saying, look, the onset was shortly after I took a COVID shot. I got psoriatic arthritis as a result of a vaccine.
Wow.
And then within about a year, my my femurs started hurting, like, I mean, bad. And I thought this was just I was told this is just, hey, it's just getting worse.
You're old. You're just old. I hate that answer.
Yeah, you're just old and you're getting worse. And then so when I saw the calcium was elevated, I was like, am I just worse? Or are my bones leaching calcium right now? So anyway, they found a parathyroid adenoma and zipped that out. And so the bullpen was what we did in medical school, our surgery department in medical school, as part of your testing process and to get accustomed to oral exams.
Yep.
Did something for the medical students called a surgical bullpen, where you are a third-year surgery resident. I mean, a third-year medical student. So you don't know squat, okay? And when you're on your surgery rotation towards some point in time, halfway through is when they start testing the students. You walk into the hospital. This is a charity hospital in Shreveport. You are assigned a patient. You have no access to their chart. You are to examine the patient, talk to the patient. After you've kind of done your history and physical, you get an hour to go to the library and just kind of look up your differential, just kind of remind yourself what it is, whatever. Then you had to go pick up the patient, put them in a wheelchair, wheel them into an auditorium in front of the entire third-year medical students, the entire surgery department, and the chief of the department. Yeah, I know. You had to present the patient to the crowd. Now, of course, the residents knew who the patient was, and some of the students would know who the patient was, but you don't. And then you start getting asked questions, like an oral board exam. And then what would you do? Is there a particular test you would like to do? And you would say, well, I mean, I think this person needs an ultrasound. And then they'd show you the ultrasound. All right, doctor, now what? Well, on this ultrasound, I see this, so I think I would want to have this test, right? And so you just work through the process.
Yeah.
And so you had to do that very publicly. And of course, the patient has no clue what's going on. Anyway, so it's one of those, you're on the spot about a variety of different topics, and where you just work through the logical construct of, okay, you have belly pain. Okay. So the first thing that you should probably do is take a look at your diet. Let's do a diet symptom, whatever. So it's me every Thursday morning at 6 o'clock in the morning, early in the morning, because we're surgeons, and that's the only time I have time. And it's we live stream it, where I'm not talking to a patient. I'm making up kind of imaginary patients.
Interesting.
Yeah, diverticulitis, colon cancer, whatever. Or right about that time, I got put on the medical board of a company, which is fascinating, by the way. It's called Superpatch. And it sounds hokey at first, but it is a technology. This is considered a medical device. It is a patch with a texture on it that's very specifically made so that when it's making full contact with your skin, it sends an organized signal through the autonomic nervous system to your brain to straighten out very particular neurologic pathways. So if you cannot sleep, there's no medicine in these things. There's no contraindication. There's no side effects. It doesn't make you drowsy. It just organizes the sleep process. So you put it on an hour before you sleep, and when you lay down, you fall asleep quicker, you stay asleep longer. But it's it's fascinating. Yeah, it's just fascinating. It's called, in fact, I'm giving a lecture to their organization on Saturday about basically that mechanism. It uses piezoelectric channels in the cells to communicate with the brain, and on EEGs, electroencephalograms, this is where they do little squiggles of your brain, the brain waves. You can see on the brain waves they'll take a pathway that looks abnormal, and it'll return to normal when you place the patch. You take off the patch, it goes back to abnormal. So it's a fascinating, it has the potential of revolutionizing medicine because it doesn't work on the biochemical. It works on the physical world, not the biochemical world. So
that's the pattern for sleep, or they have patterns for multiple things.
yeah.
sleep.
They've got one for pain, one for sleep. The one that I wear daily is called a peace patch for stress. On an EEG, if you're wearing one of those peace patches, your EEG looks like you just did 8 hours of meditation. So for really long, complicated, some of my surgeries are very, very long. Some of them are very short, but some of them can be 14 hours long, And so like, how do you keep your cool? How do you keep your focus? And there's no drugs in it. So you're not going to be loopy or stupid or whatever, but it calms down your stress. He has one that simulates caffeine without giving you the jitters, without making you tachycardic, without giving you the shakes. Yeah, doctor, you heard me.
I'm about to Google these people.
Yes, I'll send you a link.
Yeah, sorry, I'm beeping. People are asking questions, but
they can ask something.
What is Xyve7?
Oh, okay. So, okay, now this is my favorite part.
Xyve.
It's Xyve7. Xyve is Greek for alive, I guess, or some such thing as that. And I didn't name the product, but I helped design it. It is a digestive product that is more than just a probiotic. It does have 4 bacteria in there. 3 of them are the lactobacillus that are important for the estrogen, what we call the estrobiome. So the microbiome of your body that helps women normalize their estrogen levels, that actually comes from the microbiome, believe it or not. And so one of the gut problems in menopause is an imbalance of these types of bacteria. So they're in that supplement. There are digestive enzymes in there as well, right? Just like the kiwi fruit helps because there's a digestive enzyme. There's a bunch of different digestive enzymes in Xyve7, and then there are some herbals in there as well, which support acid in the stomach and bile out of the liver and anti-inflammatories and stuff that help promote motility and help protect you from these biofilms from bad bacteria that kind of cling to your colon. So you can kind of strip all that stuff away and have healthy, normal mucosa that's intact without the inflammation. So very, very helpful for belly bloating. Like that's one of your early questions, like what do I do with belly bloating? Xyve7 before you eat. For absolute no question.
Interesting.
No question. Very, very helpful.
I'm going to haul on down to Texas and just have lunch with you because I think
come visit.
Yeah, I'll come and visit. But before I let you go, because I could go on and on.
Yeah.
Oh, you know what? I just had a brain fog moment because I had it in my brain and then I went off a little path with you and now I'm back. But it'll be actually, I think I do have a little ADD. It'll be good. Well, I've loved this conversation because like I said, A, I don't get to talk to a lot of other female surgeons. B, we don't talk enough about this kind of gut health within the community and there's a lot of people in the community that I serve, but we don't talk about it like this. It's all pretty soft and all take the right probiotics. So I really appreciate this real world approach that you
honestly, for your listeners, if they want to know best probiotic to take, is actually not a probiotic at all. I mean, please take Xyve7. That'd be fantastic. But if they will take a supplement called inulin, inulin is a prebiotic fiber. And if you're taking a prebiotic fiber, the bacteria in your intestinal tract, provided that you're not killing it off with antibiotics and that you're avoiding processed foods, like if you're on the clean diet, if you will take inulin, you will do more for the diversity of your microbiome than almost anything else. I don't think you need to spend $200 a month on, Akkermansia and all those kind of hot rage buttons or whatever. As someone who used to do anaerobic bacterial research, almost impossible to ensure that Akkermansia is anaerobic. It's associated with normal weight. A lot of women will take this and they'll spend the $150 a month because they want to be normal weight. That bacteria belongs deep, deep, deep within the colon in an anaerobic location. There's no way to control that it's not going to pop out somewhere else. And the second it sees oxygen, it's dead. If you have a poor microbiome to begin with, you never really achieve anaerobic condition anyway. It's another reason people will have digestive problems. So your body will make Akkermansia in the proper amounts if you feed it inulin. It costs $8 for like a 4-month supply. You know what I'm saying? So like, why? I would start with a clean diet and inulin.
Mm-hmm.
Let that roll for about 3 months. And if you're still having a problem, then reach out for a probiotic, but I would not just choose one that has one bacteria in it.
Yeah.
Choose something like the Xyve7 where there's multiple. You want a group of guys in there. You know, yeah, you want a group of guys in there working together. So that would be my advice. Multi-organism probiotic, but truly a clean diet, and inulin as it's called a prebiotic. Those two things will do 85% of the work for you.
I love it.
And then an multi-organism probiotic will do the other 15% to get you over the hump.
This is such good advice and all science backed. And Dr. Anna Toker, I can't wait till the next time I get to talk to you. And I'm going to direct all my people to your pages because I just think you have so much to teach us in the most hilarious, fun way. So thank you.
Pleasure. I enjoyed talking to you. I could talk for hours on the topics.
It's all good. It's so much fun. Thank you so much.
Yes. Enjoy the rest of your day.
Bye.
Happy surgeries. Bye.
Thank you so much.
Sure.
You need to stop recording. Okay. I do a lot of live events. So when I bring all these brilliant people, I'll see if you're available because you will have so much fun with us. So thank you.
I would love to. I'm happy to do it.
No one has your expertise. You're bringing a unique thing to
It is a unique. There's not a lot of colorectal surgeons in the space, that's for sure. And do check out the Superpatch, people, because it is fascinating.
Yeah,
their pain patch. It will revolutionize medicine, in my opinion. No.
Available on the market right now, right?
Yeah, it is. Yet that you buy it online. It's an online product. They are they want to have it in doctors' offices, like as samples, and then the patients can go online and buy, kind of a deal. So they're working on that part of it. But I can send you I'm going to be frozen in. I may not make my meeting in Orlando, so I told him that I would record.
Oh yeah,
a lecture. And so I'll send you a hot link to that recording so you can see with your own eyeballs kind of what it is that I'm talking about, because you might find a role for that in your practice and in your community. And I mean, and they do have a model. It's like you buy wholesale, you sell retail, kind of a situation. But more importantly, there's no medicine in it. Like, my outcomes after surgery are vastly better since I stepped away from narcotics and big pharma and whatnot.
Yeah, I don't use narcotics, but so I'm very interested. I'll look it up.
Yes, and I'll send you the video.
Thank you.
And
I'll talk to you soon. Thank you so much.
Yeah, it's so nice meeting you.
Nice to meet you, Anna. Bye now.
All right, bye.
I'm Dr. Vonda Wright. See you next week.